For many people and couples, maintaining a good and enjoyable sex life is a vital part of their overall well-being. Erectile dysfunction, or the inability to sustain an erection, is a frequent condition that may have a substantial influence on sexual encounters. While occasional erection difficulties are natural and not cause for alarm, chronic troubles may be annoying and possibly contribute to relationship conflict or low self-esteem. Understanding the variables that might lead to erectile dysfunction is critical for treating and avoiding these issues. In this post, we will look at the top 5 factors that might kill erections and explain practical ways to prevent them, allowing you to have a full and pleasant sex life. Stress and worry are at the top of our list of erection killers. In today's fast-paced world, it's all too usual for people to feel overwhelmed by job demands, money worries, marital problems, or other life stresses. When these anxieties enter the bedroom, they may have a major influence on sexual performance. Stress causes the production of cortisol, sometimes known as the stress hormone, which may impair the body's ability to develop and sustain an erection. Furthermore, worry about sexual performance may create a vicious loop in which the dread of not being able to obtain or sustain an erection causes difficulties in doing so. To address erectile dysfunction caused by stress and anxiety, appropriate stress management practices must be developed. This might involve practicing mindfulness meditation, deep breathing techniques, or progressive muscular relaxation. These approaches may assist to relax the mind and body, decreasing the effects of stress on sexual function. It is also critical to provide a relaxed setting for intimacy, devoid of distractions and outside influences. This might imply setting apart specific time for sexual engagement, away from work or other duties. Communication with your spouse is essential. Openly sharing any issues or fears may assist to reduce performance pressure and establish a more supportive environment. For people dealing with chronic stress or anxiety, receiving professional support from a therapist or counselor may be quite useful. Cognitive behavioral therapy (CBT) has been demonstrated to be very beneficial in treating sexual performance anxiety and other stress-related disorders that might impair erectile function. When it comes to sexual well-being, remember that taking care of your mental health is just as vital as keeping your physical health in order. Poor lifestyle choices, especially in terms of nutrition and exercise, are the second most common cause of erection problems. A diet heavy in processed foods, saturated fats, and added sugars may lead to obesity, high blood pressure, and diabetes, all of which are risk factors for erectile dysfunction. Similarly, a sedentary lifestyle might impair cardiovascular function, which is essential for sustaining powerful and long-lasting erections. To address these difficulties, eat a balanced and nutritious diet high in fruits, vegetables, whole grains, lean meats, and healthy fats. The Mediterranean diet, in particular, has been linked to enhanced erectile function. This eating style emphasizes plant-based cuisine, seafood, olive oil, and moderate use of red wine. Certain foods have even been termed natural Viagra because of their ability to improve erectile function. These include watermelon high in citrulline, which promotes blood flow, dark chocolate high in flavonoids, which helps enhance circulation, and oysters heavy in zinc, which is essential for testosterone synthesis. Regular exercise is also essential for sustaining erectile function. Aim to do at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic activity per week. This may involve brisk walking, jogging, swimming, and cycling. Strength training activities, especially those aimed at the pelvic floor muscles, might be advantageous. Kegel exercises, which include contracting and releasing the muscles that govern urine, may help strengthen the pelvic floor while also improving erectile function. The third factor that might kill an erection is excessive alcohol intake and drug addiction. While a glass of wine or a drink may help set the tone for intimacy, excessive alcohol use may have a negative impact on erectile function. Alcohol is a depressant that may impair the neurological system's capacity to transmit impulses between the brain and the penis, making it harder to get or sustain an erection. Chronic excessive drinking may potentially cause long-term harm to the nerves and blood vessels required for normal erectile function. Similarly, the use of illegal substances, as well as some prescription pharmaceuticals, may have a detrimental influence on sexual performance. Drugs such as cocaine, marijuana, and opiates may all impair erectile function in different ways. Even regularly given drugs, such as antidepressants or blood pressure meds, may cause erectile dysfunction. To prevent these problems, drink alcohol in moderation. If you want to drink, keep it to 1 or 2 drinks and be mindful of how alcohol affects your body and sexual reaction. If you are taking any drugs that may be affecting your erectile function, talk to your doctor about possible alternatives or changes to your treatment plan. Never discontinue taking prescription drugs without first seeing your doctor. Those who are battling with substance addiction should seek expert treatment. Addiction treatment programs may provide the assistance and resources required to overcome addiction and enhance overall health, including sexual function. Smoking is the fourth major risk factor for erectile dysfunction. Tobacco smoking is a significant risk factor for erectile dysfunction because it damages blood vessels and reduces blood flow throughout the body, especially to the penis. Smoking also adds to the formation of plaque in the arteries, known as atherosclerosis, which may further decrease blood flow. Furthermore, smoking may reduce blood levels of nitric oxide, a molecule that aids in the dilation of blood vessels and the increased blood flow required to achieve and sustain an erection. Quitting smoking is one of the most essential things you can do to enhance your entire health, including your sexual health. While quitting might be difficult, there are several options available to assist you. Nicotine replacement treatment, prescription drugs, and psychotherapy are all helpful aids for quitting smoking. It's crucial to note that quitting smoking has far-reaching advantages beyond enhanced erectile function. You'll lower your chance of heart disease, lung cancer, and a variety of other health issues. If you don't smoke, you should also avoid secondhand smoke, which may be harmful to your cardiovascular and erectile health. Create a smoke-free atmosphere in your house and urge family members who smoke to quit or smoke outdoors. The fifth and last erection-destroying element we'll look at is hormonal abnormalities, namely low testosterone levels. Testosterone regulates male sexual function, including desire and the capacity to develop and sustain erections. As men age, their testosterone levels naturally fall, but certain lifestyle habits and medical illnesses may hasten this process or result in unusually low levels. Symptoms of low testosterone include reduced libido, difficulties establishing or sustaining erections, exhaustion, diminished muscular mass, and mood fluctuations. If you feel you have low testosterone, you should visit a doctor. They may do a blood test to examine your hormone levels and, if required, discuss possible treatment choices. There are various natural approaches to promote healthy testosterone levels. Regular exercise, especially strength training and high-intensity interval training (HIIT), has been linked to increased testosterone levels. Ensuring proper sleep is also critical, since testosterone is predominantly created when sleeping. Aim for 7 to 9 hours of good sleep every night. Maintaining a healthy body weight is also crucial, since excess body fat might cause increased testosterone conversion to estrogen. Specific nutrients are also required for testosterone synthesis. Zinc, present in foods such as oysters, steak, and pumpkin seeds, is essential for testosterone production. Vitamin D, which may be derived via sunlight or supplementation, has been related to testosterone levels. Consuming healthy fats, such as those found in avocados, almonds, and olive oil, may also aid in hormone synthesis. In certain circumstances, a healthcare physician may offer testosterone replacement medication. This medication may be delivered by injections, gels, or patches. However, it is crucial to highlight that testosterone treatment has hazards and should only be used under constant medical supervision. It's worth mentioning that, although we've concentrated on 5 significant variables that might affect erectile function, there are several more possible components to consider. Diabetes, hypertension, and heart disease are among chronic health issues that might have an impact on erectile function. Regular checkups with your healthcare practitioner, as well as the treatment of any pre-existing health concerns, are essential for preserving general sexual health. Furthermore, the value of open communication with your relationship cannot be understated. Many erectile disorders have a psychological component, and a partner's support and understanding may help you overcome these obstacles. If erectile dysfunction is straining your relationship, consider couples counseling or sex therapy. Finally, sustaining strong erectile function is a multidimensional task that requires attention to both physical and emotional wellness. By addressing the 5 key factors we've discussed: stress and anxiety management, adopting healthy lifestyle habits, limiting alcohol consumption, and avoiding substance abuse, quitting smoking, and maintaining hormonal balance, you can significantly increase your chances of having a satisfying sex life well into your later years. Remember that occasional erection problems are natural and should not cause alarm. However, if you're suffering chronic issues, you should seek medical attention. A healthcare expert may assist evaluate whether there are any underlying health conditions that are causing erectile dysfunction and discuss suitable treatment choices. Finally, preserving erectile health requires a comprehensive commitment to well-being. This involves eating a well-balanced diet, being physically active, managing stress, avoiding hazardous drugs, and cultivating strong relationships. Prioritizing your overall health and well-being not only benefits your sexual function, but also improves your quality of life in a variety of other ways. Here's to having a healthy, happy, and rewarding sexual life for years to come. Did you find this video helpful and exciting? Here is another video you can watch that's even better. Even if that doesn't interest you, then here's one more. Subscribe and hit the bell icon as well.